A serious outbreak of malaria has reached epidemic proportions in Burundi, where it's affecting nearly half the population. Health officials in neighboring Uganda are also reporting a significant upsurge of up to 40% in malaria cases this year. The Ministry of Health says refugee influx, climate change, and a decline in the use of protective nets is attributing to the increase in the mosquito-borne disease. CGTN's Ayesiga reports. Let's take a look.
Battling bouts of malaria, Derek Mayengo is among many patients here fighting the disease. A recent survey by Uganda's health ministry shows that malaria cases are up by 40%.
When I came in, one, as the heat was too much, two, a bit of joint pains, and then too much headache.
Children under the age of 5 are most vulnerable. Symptoms include high fever, nausea, vomiting, and headache, among others. This health facility receives on average 10 patients every day with symptoms of malaria. And after treatment, health workers here are encouraging them to use preventive methods such as sleeping under a mosquito net. Health officials say a general decline in the use of mosquito nets is just one reason for the increased numbers of people with malaria. Population growth and prolonged rains also help fuel the spread of the disease. The rains provide breeding ground for the mosquitoes that transmit the disease from one person to another.
The number of cases of malaria have increased by over 400,000 this year when compared with last year, from about 1 million cases in June 2018 to 1.4 million in June 2019.
Ugandan scientists plan to breed genetically modified mosquitoes as part of a plan to fight malaria in Africa. But that's a long-term solution. And for now, the health ministry says anti-malaria drugs, use of mosquito nets, and indoor spraying are the best available weapons to keep the killer disease at bay. Ayesiga, CGTN, Kampala.